today. And I'm going to direct this one to Dr. Tignanelli, who's just joined us. In a couple of minutes, could you describe to us what your priority has been as it relates to AI in healthcare, please?
Sure, happy to, and thank you for having me. Um, so I'm the scientific director of our program for clinical AI at University of Minnesota, and I'd say we probably have three main focuses when it comes to AI. Um, the first one is developing novel AI systems that can help solve problems in healthcare. And a lot of times those are brought to us by your pure clinical practicing clinicians, and not so much research clinicians like myself, but people who day in and day out, all they do is see patients. A lot of times they can very well identify like these are certain problems that we need help with. These are, well, anyway, yeah. So that's kind of one of them. The next one is how do we implement AI into practice in a trustworthy manner, and also improve the adoption and use of AI by clinicians. So how do we make it explainable? How do we allow the AI system to communicate with physician and be like, I have a certain amount of certainty in this prediction, or this is an area where there wasn't a lot of training data, so my certainty is 25%, for example. How do you actually do that? And then the last piece is really around monitoring deployed AI. What are best practices around monitoring deployed AI solutions? How do we decide when AI needs to be turned off and optimized? Where is that threshold? There's no formal guidance out there right now. So I say those are kind of the main pieces that we're working in.
Great. Thank you so much for that overview. My next question I'm going to direct towards Nate. And please, everyone in the audience, continue to send your questions in the chat if you would like to, or if you would like to ask your question yourself, you may raise your hand and we can call on you and you can direct your question to the speakers as well. So, Nate, you presented market pathway challenges with some of the descriptive use cases for medical devices in your talk. What do you see as the biggest challenge for getting approval for an AI ML medical product?
Yeah, I think the biggest challenge is being able to communicate what your device does so you can have predictability. There's going to be a pathway, right? But if that pathway is a PMA and it didn't have to be, you're going to have multiple years and many millions of dollars more than if you could have found a different pathway. And so if you can get in front of FDA early and share your capabilities, really maximize your story, if you will, and start to walk FDA down that path and understand the risks and mitigation of risks, then you can find a pathway earlier on, whether it's de novo or 510(k), and really pushing for 510(k) where you can. That's going to ease a lot of work on the back end as well as give predictability, right? If you're a startup, it's very hard to overemphasize the difference between being able to launch in 18 months versus 4 years, right? Like one, you might not even be able to do at all. 18 months, you might be able to do so. And so getting it right early on and finding your right market pathway that utilizes the full capabilities of your device or as much as you can is a challenge. But once you get it right, then you have predictability. Even if you think about investors, they like to know that if you have a set path, it's much easier for them to invest in your device and to understand that, ultimately you should see market utilization of your device, which obviously is something they're looking for. And so that's the biggest challenge, but it's also the biggest benefit if you can figure it out early, because then you can show a lot of, like I said, investors, but also just the business predictability is so great when you have an early identified regulatory strategy.
Thank you. That's great advice and background information. So, my next question is coming in directed for Kelly Henderson. When speaking about the framework that Alina applies in what Dr. Hansen and you presented about Alina's very focused and stepwise approach to determining appropriate use of AI in CDS, for example, how would you balance bringing in a model that is maybe more closed and protective of not making accidental disclosures to an outside generated model or generative model, and if you were to use something that's in a closed universe within the enterprise alone, how would you balance the benefits or the risks that may come to the individual patient by choosing a closed model system?
Yeah, I think that's a really good question. And I think that's one that would require a lot of discussion with our physician advisors, because I think that becomes, I think the centrality of patient care is the thing that we always have to keep in mind. And so we have to balance the what's best for our patient population more so than what's the legal risk. I think I always want, patient care to come first, and we can deal with the legal risks later. And, I would welcome Dr. Hansen's thoughts on this too, but it seems to me that when making that sort of decision between an open versus closed system, that really needs a lot of clinical input and kind of that enterprise risk lens.
Yeah, I'd agree. I mean, I think this is, why we've set up the system or the structure that we have at Alina, to make sure we have the multidisciplinary group who kind of looks through all of this, and then, really examining, where is the output going, and, what kind of oversight is there over that output of the model. So it's very important in these cases.
Great. Thank you both so much.